My name is Roger Wicks. Was born in 1949 in Nottingham. Was diagnosed in 2019 with prostate cancer, which unfortunately had spread to my lungs and to my bones. I had my treatment at home, which was really a blessing, and LloydsPharmacy Clinical Homecare were a real treat because they came to my house, they looked after me at home, they gave me the chemotherapy at home.
My name's Jade Mickelson. I'm an oncology nurse and services manager. So LloydsPharmacy Clinical Homecare is a specialist home care service where we provide patients their treatment in their own home.
Because it was all at home, there was never any stress or strain of having to drive to from the hospital. I was always in a very relaxed frame of mind while the chemotherapy was going on. One of the side effects of chemotherapy is you can lose your hair. I, as you can see, kept all mine, and that was down to a phone call I received from LPCH to discuss the use of a cold cap machine. Well, this little machine here sat in the corner of my room, didn't take up a lot of space, and it saved my hair. It was just a great piece of kit. I would have to wet my hair, put a bit of conditioner into my hair. I would then sit down and the nurse would help me fit the cold cap. If ever you've stood out in a snow blizzard or out in a cold condition, if ever you've been on top of a mountain or somewhere where it's cold, you'll find that after 2 or 3 minutes you're used to it.
I'm Deborah Gibson. I'm a Paxman at Home and Training Specialist. Once we receive a referral from LloydsPharmacy Clinical Homecare, we will contact you in your home environment and arrange for delivery of the system. Then I will contact you and arrange an appointment for me to come along to see you. I'm there to visit patients in their home before they start chemotherapy treatment. This involves talking through everything they need to know about scalp cooling. I offer advice and support throughout the whole of their scalp cooling treatment.
I think the secret of it all was the fact that I was at home. I wasn't going off to some hospital, and everything worked around me, not me around it, if that makes sense. And that made a big difference to the way I reacted to the whole process.
As a home care nurse, it feels really valuable to be able to support patients like Roger with scalp cooling as part of their cancer treatment.
I mean, the nurses were excellent at all times. They were always supportive of me and my wife through some difficult times, as everybody goes through when they're going through chemotherapy. And having the scalp cooling machine enabled me to keep all my hair, and having it at home was a real blessing.